Greetings. This video is long, but it is important to make time to listen to all of it, as what we have to say at the beginning is as important as what we have to say at the end. This video will tell you about part of your hospital called the emergency department. It will tell you about why you may want to go to the emergency department, what happens when you get there, and what to do after you leave. The emergency department is also known as the emergency room, or the ER. It is part of a hospital where sick or injured people are assessed and treated by a team of doctors, nurses, or other medical providers. Sometimes it is hard to know whether a health problem is an emergency or not. If you are not sure if your health problem is an emergency, you can call your regular doctor's office and they can help you decide whether you should see your regular doctor or go to the ER. ERs are open day and night, every day of the year, and you can go in at any time with your emergency. You do not need an appointment. You do not need health insurance to visit the ER, and you will not have to pay before you receive care. The ER is a safe place, no matter what your immigration status is. Any person of any age may go to the ER when their health emergency is severe or if they are afraid their health condition is life-threatening. If the problem is very urgent and severe, you may need to call 911 for advice and transportation to the hospital. You can choose who goes with you to your hospital room. You do not need to have anyone in the room who you do not want there. You can ask to meet with a doctor who you feel comfortable with, and the ER staff will do their best to support you. The doctors will ask you a lot of questions about how you are feeling and about health problems you had in the past. Everything you tell your doctor is private. The more information you give the doctor, the better they will be able to help you. You will arrive at the ER either in an ambulance or with your own transportation. If you arrive in an ambulance, you will be taken straight to a room for an examination. If you arrive by car or bus, or if you walk to the ER, you will go through a security check. You will then tell the person at the front desk your name, birthday, and the reason you came to the ER. If you need an interpreter, you can ask for one. You have a legal right to have an interpreter during all healthcare visits. You will sit in the waiting room and wait till you hear your name. Then you will meet with a nurse who will get more information from you to assess how serious your health problem is. The nurse will ask about what you are feeling and take your temperature, your blood pressure, and your heart rate. You will then return to the waiting room until a room is available. At the ER, the order you will be seen depends on how serious your condition is, not how long you've been waiting. If your health is in danger, you will be seen earlier than someone who is sick but not in danger. The number of hours you spend at the ER will depend on how busy the ER is and how serious your situation is. When you get to your room, someone will come to see you to make sure they have the correct information about you, including whether or not you have health insurance, and also the name of your regular doctor. This is called your primary care provider. Remember, you do not need health insurance to receive care. Remember to ask for an interpreter. Here are some examples of reasons you may need to go to the ER. If you have severe chest pain that does not get better, numbness or loss of feeling in your arm, face, or back, as well as chest pain, may be a sign of a heart attack. If you have severe stomach pain that doesn't get better, especially with fever, and especially if you have blood in your poop or if you are throwing up over and over again. If you lose consciousness, especially after hitting your head or with shaking of your body. If you have a really bad headache and you have hit your head. If you have a really bad headache and are taking a blood-thinning medication. If you have a really bad headache and you have high blood pressure or are pregnant. if you have a really bad headache with fever and neck pain, if you have trouble breathing or cannot stop coughing, if you have an allergic reaction with an itchy rash, trouble breathing or swallowing, swelling of face or tongue, or if you use an EpiPen. If you suddenly have trouble walking, speaking, or weakness in one side of the body. If you have a cut that will not stop bleeding. If you have an injury and are worried you have a broken bone. If you have a high fever that doesn't get better even after taking fever medication. If you have a high fever and have traveled in the past 3 months to a part of the world where malaria is common. You should go to the ER if you are pregnant and are bleeding or in severe pain. If your baby is under 3 months old and has a fever. You should go to the ER if you have very bad back pain and also have numbness below the waist and a fever. Or if you have bad back pain and also cannot pee or control your peeing or pooping. You should go to the ER if you are pregnant and you think the baby is coming and you don't think you can get to the hospital on time. You should call 911. You can dial 988 for immediate help for severe emotional problems. And you can go or take a loved one to the ER if you are concerned because you or they accidentally or on purpose took too much medication. You should go to the ER if you or they are hearing or seeing things that other people cannot see or hear. You should go to the ER if you or your children have been physically or sexually hurt by someone you know or someone you do not know. You should go to the ER if you or someone you know are having thoughts of wanting to hurt or kill yourself or hurt or kill other people. After your visit to the ER, make sure you make an appointment to visit your regular doctor, your primary healthcare provider, to check in 2 to 7 days after your visit to the ER to make sure your health is improving. Sometimes the doctor at the ER will recommend that when you leave, you take medication to help your illness. The doctor may call your pharmacy on the phone to give them the prescription, or the doctor might give you a paper with the prescription written on it, and you will take the paper to the pharmacy yourself. Sometimes the doctor will recommend that you buy medications that do not require prescriptions, for example, medicine to help lower a fever. Information about the medicines will be written on the papers they give you before you leave. Make sure you understand where to get the medicines before you leave the ER. If you feel worse after you leave the ER or your symptoms change, return immediately to the ER. Sometimes the results of tests that were performed in the ER take a few days to come back. It is important that you give the ER a phone number that they can call you on. Please pick up the phone when they call. You will receive a bill after your ER visit with the name of the hospital that you attended. Please open the bill. Even if you have health insurance, you may still have to pay part of the cost of the bill. If you need assistance with the bill, you can call the hospital and ask to speak to someone in billing, and they will work with you to help you pay the bill. The number for the hospital will be written on the bill. Remember to ask for an interpreter. Please open the bill and ask for help if you need it. You can go to the ER for any reason, but there are times when it makes more sense to go somewhere else to get your health care checked out. You might want to go see your regular doctor or go to urgent care. In our next video, we will tell you more about visiting your doctor or going to urgent care.